People living with dementia are just as likely to suffer from pain as any other residents living in aged care. But as their dementia worsens, they increasingly lose the ability to talk about or describe their pain. Some people living with dementia can tell you about their pain, but you must take time to ask and to listen. Sit down and make eye contact. Speak clearly, not too quickly, and allow plenty of time for their response. Choose words for pain that they understand. Ask about their current pain so they do not have to rely on their memory, and remind them of old injuries or disease that might be causing pain. Most important is that you show genuine interest and concern. A person who is unable to speak about their pain or can't fully understand the pain they are experiencing may instead show changed behaviours. So it may be the pain is causing the person living with dementia to yell, resist care, be anxious or depressed, be less likely to want to move, be less active, or change from their normal routines. These changed behaviours are signs of pain, indicating there may be pain. When providing care, we need to be careful that we are not provoking pain. So look out for these changed behaviours when assisting with personal care such as toileting or showering, and when assisting with transfer. Watch how a person is acting whilst they are moving and participating in lifestyle activities. We may need to change our procedures so that when we assist a resident move, both during transfer and after they are seated or resting in bed, that any musculoskeletal injury is supported or skin injury is protected to maximise comfort. We might need to consider an analgesic prior to activity that could provoke pain if non-pharmacological strategies alone are not enough. There are many changed behaviours to look out for. Here are just some examples. Remember that these behaviours may not be due to dementia. They could be due to pain. Yelling, calling out, groaning and crying are all changed behaviours that may be a sign of pain.
Don't.
Frowning, grimacing, looking fearful are all changed behaviours that also may be a sign of pain. Fidgeting, rocking, guarding, withdrawing, resisting care and striking out are all behaviours that may be a sign of pain. Changes in appetite, refusing mouth care, fatigue, and any changes in usual routine at all are all changed behaviours that may be a sign of pain.
No.
Changes in mood, depression, and socialisation are all changed behaviours that may be a sign of pain. Changes in pulse, perspiring, flushing or pallor, contractures and stiffness, pressure sores, skin tears, and any old injuries such as lower back pain are all indications that there may be pain. For a person living with dementia, when we see these changed behaviours and suspect pain, we conduct a pain assessment. Assessment and charting tools have been designed specifically for people living with dementia. They focus on these changed behaviours that might indicate pain. Most common assessment tools for people living with dementia are the Abbey Pain Scale and the painACT app. We generally use these tools for residents living with advanced dementia or other conditions that limited their ability to meaningfully tell us about their pain. With only a little training, most staff should be able to use these tools.